Hello and good evening, everyone. Welcome to 365 Live. My name is Gary and I'll be your host for tonight's live session. Now, before we get underway with our sharing tonight, just a gentle reminder that all information shared at this event by our speaker and 365 CPS is for general information only. So please do consult your doctor for personalized and detailed medical advice. Now, of course, why we're all here tonight is we have a fantastic speaker that I'm so glad to have with us today. So without further ado, I'm pleased to introduce tonight's speaker, Dr. Valerie Young, who's a senior medical oncologist at Oncocare Cancer Center. She's here tonight to talk about sarcomas, so what they are and how they are being treated. So please remember, if you have any questions, post them into the chat and we were definitely going to get to them. And Dr. Valerie will address these questions during our Q&A session. So I'd like to introduce and invite Dr. Valerie on stage here tonight.
Hi, Gary. How are you?
Thank you so much for joining us tonight and, of course, making time for us and our audience and to share your knowledge as well.
My pleasure.
And, sarcomas, I mean, I've been drilled about sarcomas in my background back in my medical schooling. Osteosarcomas, which are bone sarcomas, but I do hear that this session is just as important for public as it is for healthcare practitioners as well.
Yes, so we're going to be talking about all sarcomas. So, osteosarcomas, soft tissue sarcomas, but you're absolutely right. This is a public education talk, but actually we frequently do give education talks to healthcare professionals as well. This is because sarcomas are actually very, very, poorly understood. So even healthcare professionals may not know very much about sarcoma or, when they should suspect one or how best to deal with it, as opposed to dealing with just a benign lump. So it really is something that is not very well understood at all.
Yeah, it often presents as a lump, right?
Exactly. Yeah.
Okay, so I'm sure you're going to be sharing with all of us how we can figure out which lumps are worth checking out. So I'm going to hand over the time to you. Thank you very much.
Okay. So, yep, I think you can see my slides. So this is what we'll be talking about today. Thank you, Gary. And this is me. So I'm one of the sarcoma specialists in Singapore, operating out of Oncocare Cancer Center. I also lead a translational research group at the A-STAR laboratories, including IMCB and the Bioinformatics Institute. And I also hold a university position at UKNUS Medical School. So without further ado, what is sarcoma? We'll be talking about, the types of sarcomas there are, what are the signs, as Gary mentioned earlier, how is it diagnosed, and importantly, how is it treated? So just to take a step back, even before we go into sarcoma, just about cancers in Singapore as a whole. So as you know, normal cells basically should undergo a regulated growth and proliferation. However, when it becomes, cancerous, what happens is that it starts to become a mass, starts to invade, and maybe even may start to spread to other parts of the body. So in fact, the most common cancers in Singapore, and listed here are the top 10 most common in males and in females, you will notice that actually sarcoma is not listed in any one of the top 10. And that's because sarcomas are actually quite rare. But having said that, can also be very important to know about because it can really happen to anybody. So what is sarcoma? As I mentioned, it is a rare yet deadly type of cancer. So rare in that it makes up only about 1% of all adult cancer cases. But if you look among the children and teenagers, so in this younger age group, they actually account for more than 20% of cancer cases in the younger age group. Sarcoma can actually arise from anywhere in the body, mainly connective tissues, including the fat tissues, the bone, muscle, blood vessels, digestive tract, the nerves. So in fact, there are over 100 types of sarcomas. They all have different characteristics. the way they appear in the body, their genetic features, and how well or not well they respond to therapy are all quite different as well. So it is not only rare, it is also quite complex. So I think the fact that everybody in our audience who's here tonight and deciding to spend some of their Saturday night here to listen to this talk is already a very good start, because you're learning about something that not everybody knows about. So thank you for being here. So what types of sarcoma are there? I would broadly classify them into the two main types. So first of all, that being soft tissue sarcoma, and then second of all, the bone sarcomas. Okay, so before we go into some of that, I just want to also point out here on the right-hand side, you'll notice, like what I mentioned earlier, there is a distribution of age groups. So really, sarcomas can occur across any age, but you'll notice that across quite a lot of the sarcomas, they tend to occur in those of the younger age group, which is why earlier we mentioned it accounts for 20% of cancers in the younger population, right? So in the soft tissue sarcoma subtype, these are the ones that start from muscle, fat, or blood vessels. So commonly can occur in the arms, in the legs, tummy, or chest. Some examples, so they're named according to where they've come from. So liposarcomas, for example, because lipo means fat, liposarcoma, leiomyosarcoma from muscle, angiosarcoma from blood vessels. And then, of course, you've got the bone sarcomas, and these ones tend to have a bimodal incidence of age group where they can be common in young children, but we also do see bone sarcomas in the older age group. This starts in bones or cartilage, and some examples, I think most people would have heard of osteosarcoma, but there are also other types of sarcomas that arise from the bone, such as Ewing sarcoma or chondrosarcoma as well. What are the signs? How is it diagnosed? And you'll see here that actually it is really not so easy to, to pick up signs of sarcoma. So I'm going to talk about, again, the two main big groups. So soft tissue sarcoma and bone sarcoma. When we talk about soft tissue sarcoma, like what Gary and I mentioned earlier, it could be a lump that's getting bigger, okay? It could be painless at first. Some may rapidly increase in size over weeks to months. Some might be firm or hard to touch. Some might even be warm to touch, okay? So you can see how, anything that's a lump, we also worry about whether this could be sarcoma. But at the same time, not every lump is worth worrying about. And we'll talk about some of that a bit later on. A pain or soreness in an area, that's certainly something to watch out for. Sometimes a swelling can also be a sarcoma. It can be even vague to feel because it could arise from somewhere quite deep in the muscle. Typically, something that is more than 5 centimeters in size is something that would ring some alarm bells. Trouble moving a limb, because even the soft tissue sarcomas that don't arise from a bone can also arise in a limb, from the soft tissue parts of the limb. Trouble breathing if the sarcoma actually has arisen in the chest, or if it has grown somewhere else and then has metastasized to the lungs. Bone sarcomas, like we mentioned, actually, it is common not only in the young in the first 2 decades of life, but also can present in those who are more elderly. So some signs to watch out for include bone pain that is worsening over time to the extent that it's affecting your sleep or even, your normal daily activities. Sometimes an associated swelling can also appear in a joint or elsewhere. Sometimes, because the bone is already so affected, there could be minimal trauma or even just normal weight bearing that can result in sudden fractures. Again, if the osteosarcoma or bone sarcoma is at the point of somewhere near a joint or in the limb, there could be trouble moving the limb. And again, like in soft tissue sarcomas, if it arose somewhere near the chest, there could be trouble breathing, or if the sarcoma has traveled to the lungs, then again, there could be trouble breathing. Okay, so now on to how it is diagnosed. We use basically, broadly speaking, 3 main modalities. So first is you will need some kind of imaging, perhaps a scan, whether it's a CT scan or sometimes an MRI scan, to look inside the body. And this is to see, what the features of the lumps are, where the lumps are located, and there are characteristic findings that they make radiologists or the doctors who are looking at the scans to be able to suspect, whether this could be a sarcoma. All right. And then what is required to actually confirm whether this is a sarcoma or not is we do need a sample of the tissue. So wherever that lump is, often a small amount of tissue is taken at the first setting to have a look and see what the cells look like under a microscope. Okay. And then we often undertake further laboratory tests based on the sample to figure out what the exact type of sarcoma is. Because if you remember, we mentioned earlier that there are actually over 100 different subtypes of sarcomas, and they can all be very, very different in terms of their behavior, their genetics, and in fact, how it should be treated as well. That does make a difference. So these tests are therefore important to do before we even can talk about how we best manage and treat these sarcomas. So one very important point to say, which we did discuss very briefly at the start, is that, this entity called sarcoma, because it's so rare, most people in the public are really not familiar about sarcomas. Even some doctors may not be very aware of sarcomas. And diagnosis really requires specialist oncology teams and specialist pathologists who are trained to see and to review and to treat sarcomas. And so it's not otherwise uncommon for many of the patients who come to see me. They have often seen many other doctors, for what was presumed to be a benign lump or something that was biopsied before and was not read as a sarcoma, and had seen all sorts of, many, many different doctors before, in fact, finding out subsequently that this was a sarcoma, and then came to see sarcoma specialists. So part of educating not just the public, but also healthcare professionals is also to have the index of suspicion to say that, there is this entity called sarcomas. This should be considered and at the back of your mind whenever you see these features that could be consistent with sarcomas. On the right, you'll see some examples of what I mean by scans. So these are both actually CT scans. One example here is a lump that is near the liver region, and this is just 2 dimensions of the lump, and you can see that the lump actually shrank with some treatment that we gave the patient, so she actually responded quite well. And here is an example of, now these are lumps that are in the chest, in the lungs, in fact. And this patient, I remember, she actually presented with very much difficulty breathing. She wasn't even able to complete full sentences when I was talking to her in the clinic. She was on an oxygen tank, oxygen supplementation. And you can see she also responded to treatment with some treatment that we gave her later on. So how is it treated? Very broadly, the treatment actually depends on the type and location of the sarcoma. So many, many different types, many, many possible locations. But broadly speaking, there are 4 main modalities that are routinely included in the treatment of sarcomas. So of course, there's surgery, there's also radiation therapy, there's chemotherapy, targeted or immunotherapy. So the first 2 are basically local type of treatments to target the actual tumor. Then the last 2 are systemic treatments. So basically treatment that goes to the whole body, whether it's chemotherapy or targeted or immunotherapy. And it doesn't necessarily have to occur in this order. There are some cases which don't require specific types of treatment. And there are also some cases where systemic treatment, whether it's chemotherapy, targeted or immunotherapy, that may need to come first before surgery can happen to remove the tumor. For example, if the tumor is too large to surgically remove because the location is challenging or the size is too huge, or sometimes radiation might even be given first prior to surgery. And the general idea is that if something is not yet metastatic or hasn't yet spread, the idea is that tumor needs to be removed. And then ideally, what we also want to do is to provide good local control. So not only do we want to remove it, we also want to try and make sure we reduce the chances of it coming back And that's where radiation therapy comes in to shrink or kill cancer cells. And then depending on the type of sarcoma, we talk about systemic treatment as well. So options of chemotherapy, and then also targeted therapy and immunotherapy for some types. Okay. What is the outlook? So some sarcomas grow slowly and respond well to treatment. To be honest, it can be a bit of a range. Others are more aggressive and need stronger treatment. There are also some sarcomas that grow slowly but don't respond well to treatment. So really, there is a whole range of possibilities, and expert care therefore makes a very, very big difference in understanding these differences. And of course, early diagnosis as well. Something that is diagnosed at an earlier stage is a lot easier to handle and generally holds a better prognosis than something that is diagnosed later as a more advanced stage. So advanced sarcomas, unfortunately, the median survival across the board, in terms of a very broad bell curve, so there is a big range, median survival can be less than 1 year. So it can be very grim in some of the advanced sarcomas, especially because this is such a rare disease. So compared to some of the other common cancers where, a lot of it has very good outcomes now, whether it's breast cancer, lung cancer, or colon cancer, where, again, a lot of treatment options, a lot of drug options. Sarcomas really doesn't benefit from having the luxury of having so many treatment options because it is so rare. Okay, so very, very important. If you or someone is facing sarcoma, don't hesitate to ask for a referral to a sarcoma specialist. It can really make a big difference in care and in outcomes, okay, especially when this is a rare and complex disease that is often difficult to treat. So I just want to say that despite it being difficult to treat, if you remember, there is actually very good. I just wanted to say that there's a fantastic team of people in Singapore who also collaborate overseas, who are working on really pushing the boundaries for how we can do this better for our sarcoma patients, to give them more treatment options, to think about how best we can manage them, and how do we translate our research discoveries into the betterment of our patients. So these are just some examples of the various publications that have been put out from my laboratory and our collaborative groups across the Agencies for Science, Technology and Research, as well as the Duke NUS Medical School, and even at OncoCare as well. And this is just a slide to show how actually we demonstrate end-to-end integration of data and analysis, really to drive translational research for rare cancers such as sarcomas. So what we do is we actually take patient data, also patient samples, as well as tumor cells, which we study more about, whether it's a form of the direct tumor cells, whether it's a liquid biopsy, whether these are models from the patient's tumor itself, which have been grown in a separate model. And then, of course, they're subjected to a whole bunch of profiling, whether it's genomics, whether it's proteomics, and now to a very, very large extent as well, fine details down to the level of single cell sequencing, and also the ability to actually tell spatially. So, in terms of a particular cell's location in space, how does it relate to cells adjacent to it? So we're now down to very, very advanced technologies, which allows us to tease out mechanisms of sensitivity and resistance, precision medicine, ideally for the patient sitting in front of us, because we may not be able to rely so much on existing data, as a whole for sarcomas, because as we mentioned earlier, they're quite rare. So really, a lot of the team have used an N=1 approach, treating every single sarcoma patient, really taking a step back and thinking about what actually works for this patient. Okay. So this is a slide to just show some examples of our fantastic patients who really are, as the title at the top says, seizing opportunities, fighting to live, how young cancer patients deal with challenges and treatments. This is a patient of mine whose story is actually published on CNA, Channel News Asia, where she bravely shared her story of how she went through the process of a very, very rare metastatic sarcoma that started in the brain, how she, went through this whole process while having a young child. At the time she was diagnosed, she was actually pregnant at the time. And of course, this is to say that actually there is a Singapore sarcoma support group. So if you or anyone you know has sarcoma and you happen to be in Singapore, you're not alone. There's a whole bunch of very active individuals who support people in Singapore with sarcomas. And if you want to know more about this group, feel free to reach out. We'll certainly loop you in touch. We also routinely organize a Singapore-wide now, not just Sing Health, sarcoma and skin symposium, where we come together, not just the clinicians, but also industry partners, research partners, and even the patients and the support groups come together to discuss this very important topic and how we can all move forward as a whole. And this was an example. This was just held this month, actually. So incidentally, July, the month of July is Sarcoma Awareness Month. So I suppose also maybe that's why, Cancer 365 is holding it in July, this particular Facebook Live event. But yes, the Singapore Sarcoma and Skin Symposium was held this year on 2nd and 3rd of July. And you can see a whole bunch of fantastic individuals. I think this was just the second day, so a lot of people had left already, but it was really a packed house of many, many individuals who came together to discuss this very, very important topic. And one of the topics that we discussed was about functional precision medicine in sarcomas. So the idea is just to let you know that despite sarcomas having a very grim outlook, being very rare and complex to treat, there is a whole bunch of like-minded individuals who are working very hard to really improve outcomes for patients who have this disease. So very proud to co-chair this symposium that happens once every 2 years. And this is just some examples of the work that we've done, and we've been recognized, thankfully, as well, and provided with quite a lot of support to help our patients with sarcomas and even other cancers, and really pushing the boundaries for what we can do and advancing treatments that can give rise to better outcomes for our patients. So this is just to say thank you to, this is, an effort that is nationwide and in fact across multiple different countries, as we're also part of global consortia that also discusses and advances sarcomas in the form of clinical trials and clinical research, translational research, but also many, many, many scientists and clinicians across the board in Singapore, industry partners, laboratory professionals, clinical data specialists, and also our patients, their families, their loved ones, and really, really fantastic patients who walk this journey with us, and from whom we've learned a lot from, and many, many sponsors who've also supported our work. So with that, thank you very much. Feel free to reach out anytime you might want to ask a question. Also available on social media. And this just reminds me to say that there's an article that was, I think, yes, published in July as well, Sarcoma Awareness Month, where we talk about how anyone with a cancer, the question of how long do I have to live, doc? I think this article was really just to say we should be taking charge of our own lives. Cancer of any sort, sarcoma or not, doesn't define us. We define how we should live our lives. And if you have the time to, it might be an article that's worth looking at, and maybe encourage someone who's not feeling so up to it, to have a look and, be inspired to say how we can choose to live and live our best lives. With that, thank you very much, and happy to take questions.
Wow, Dr. Valerie, thank you so much for sharing. And I especially liked, there are a few things I actually really liked. And one is I've heard about this sort of precision, this sort of personalized precision therapies where you're assessing the genomes, the genetics. You're assessing all these different things about how that particular cancer grows in order to target that well. So I'm glad that for something as tough as this, there are possibilities that are being explored now, and of course the support groups, and that's kind of why we're also here tonight. Part of 365 Cancer Prevention Society is really to provide support and care and education and all that for the community, and our members as well. And the support groups are really very vital, and we hear that commonly with some of our members as well, and the survivors, that how support is really very important. So thank you so much for sharing. Now we do have a few questions that have come in, and I mean the first question, and I'd also love the answer to this. Thank you, Claire, for asking, is why do sarcomas tend to develop more frequently in younger individuals? And as you mentioned, like it makes up 20% of the younger age groups cancers, right? So why is that so?
Mm-hmm. That's a fantastic question. And the honest answer is we don't know the full answer to this yet. But there are many groups looking into this. I think there are some hints that have come from the research that has been done globally. So part of this is genetics. But another part of this is also just the fact that maybe it's to do also with the differentiation of cells. So sometimes we find that not all of the cells that we develop when we first develop as an embryo all naturally differentiate into all the cells that they're supposed to become. Some of them actually still remain arrested or non-terminally differentiated, and sometimes this gives rise to connective tissue type diseases, which include sarcomas. Some people think it might also be due to there's a correlation between pubertal spurts as well. So that's when you might sometimes see, the incidence of osteosarcoma, for example, in a young teenage boy, when you start to see pubertal growth spurts. So some people think there's also a link in that respect. But the honest truth is nobody knows the full answer for it. So it's a fantastic question.
Yeah, and yeah, I've heard something like that before as well, where so as you said, differentiation, and this just means that a cell, it starts off as a basic cell and it starts to form into like a hair cell versus a bone cell versus like an organ cell or something, right? And as it changes, sometimes it doesn't change maybe correctly, or it stops halfway through that process, and that's sort of where it goes through. Yeah, I've actually heard that before as well, and yeah, it's kind of scary because we have no control over that.
No, you don't. And no, Gary, it's interesting you raised that point because actually one of the emerging themes from our research as well is that we find that there is a particular cell that is almost stem cell-like that we manage to isolate from patients that tends to grow in the Petri dish even without sort of, having anything done to it. So it seems to be able to sustain its own growth in the Petri dish. And we think it is a stem cell-like, cell that has that capacity to proliferate indefinitely. So I think that sort of theme is important and is something that's actively being researched at the moment to find out, why people get cancers, and of course how we target these cancers. That becomes critically important as well.
Yeah, and I mean, if I just add on one little question to this age theme, I guess, are there? So you mentioned sort of at puberty, or the younger kids, it's because when they're growing and their body's developing that maybe these cells don't develop that well. Are there any other kind of specific age ranges that are more susceptible to development of sarcoma besides, I guess, these 2 points that we're talking about in the younger age groups?
Yeah, so I guess the first thing to say is that sarcomas actually can happen to anybody, regardless of any age group. It just so happens that in the younger age group, it represents a larger proportion. Okay, but having said that, I think cancer in general is a function of age, right? So you tend to see a lot of the common cancers happening in people who are older in age rather than the typical young teenager. So cancers in the young as a whole are actually rare, in that sense. But it's just interesting that we see a good 20% of these cancers that occur in the young tend to be sarcomas, right? But yeah, we really don't know why. You can certainly be age 80 and above and be newly diagnosed with an osteosarcoma where you never had an osteosarcoma before as a young boy.
Mm.
So I mean, it really can happen to anybody. So those of us who deal with these rare cancers like sarcomas, we never say never. We all have been taught by experience to say, never assume anything. Always take a step back and think, could this be, a sarcoma or something rare, just because we've been surprised so many times before.
Yeah. And so as a follow-up for that as well, and Jazz, thanks for the question. So we're talking about age, and it can happen to anybody. So is there something that we can do? I mean, cell differentiation, which means the cell growing and developing,
Yeah.
we don't really have control over, but lifestyle we kind of do, or diet we kind of do. Is there anything that can help with either prevention or treatment and recovery?
Yeah. Fantastic question again. Thank you, Jazz. So, the fact of the matter is really, really hard to prevent these things from happening, because we really don't understand very well, what even causes it in the first place. Okay. So, with regards specifically to sarcoma, I don't think there's, any, magic diet that we should be taking, or a specific lifestyle change. But for cancers as a whole, I think in general, what we would encourage every individual to do is really, adopting a healthy lifestyle. That also helps with cardiovascular risk. I think it's also been established that obesity, is a well-established link to cancer incidence as well. In the past, there used to be a lot of question about whether things like red meat consumption, sugar consumption, whether these things actually contribute to the development of cancer. But I think some very large epidemiologic studies have been done, and that actually shows that there's really not much difference, between someone who's eaten some red meat in their life versus someone who's completely not eaten any red meat in their life. The incidence of cancer is really not very different at all. So I don't think red meat consumption can be blamed. I don't think sugar consumption can be blamed. But in general, just, for cancer preventative strategies, not just sarcoma specifically, but all cancers, it's really about preventing obesity. It's about also, I suppose, for skin cancers, avoiding UV radiation. And then when it comes to, things like lung cancers as well, there's recently, I think 3 weeks ago, a very important Nature paper that suggests, environmental pollutants can actually give rise to specific lung cancers as well. So environmental influences, for sure, but we're only just starting to learn about it. And the sort of typical old wives' tales of the certain culprits, tended not to really be the case. But we're learning more about what's in the air, what's in the water that we drink. We certainly should be avoiding smoke, a secondhand smoke. We certainly should be avoiding UV radiation. And of course, apart from that, go for cancer screening as well.
Yeah. And I think also, I mean, I know you mentioned about sort of the red meat and the sugar, but but you mentioned about the obesity, and unfortunately sometimes sugar and obesity
may be linked.
Might be linked as well, right? And of course I mean, with sugar or just with obesity, I'll probably say a lot of people who are overweight or obese are starting to become insulin resistant, right? And a lot of metabolic changes occur, and systems don't work so well. And of course, that will predispose to a lot of problems, heart disease as well, as you mentioned, but the cancers as well. So so of course, good diets and lifestyle habits would be very, very useful. Now we have another question. So let's say somebody wasn't able to prevent a sarcoma, and as you mentioned as well, they are tricky, they are rare, not so much is known about them. And so the question from Tommy is like, well, given that there's a low response rate for these sarcomas, what are some strategies that can enhance maybe the immunotherapy or other treatments for this cancer?
Yeah. Thank you, Tommy, for the question. I think it's insightful to even ask this question because, you've asked specifically about immune checkpoint inhibitors. So that's a very specific class of immunotherapy. And you've also picked up on the fact that response rates to, most sarcoma subtypes are low to the typical immunotherapy modality that we use, which is, as you rightly say, immune checkpoint inhibitors. So fantastic question. Thank you. So there are actually quite a few promising strategies, and they're also all being used very actively now in multiple clinical trials, including those of our own, where we combine immune checkpoint inhibition with multi-tyrosine kinase inhibitors. Often these have anti-angiogenic properties. So these are, okay, I realize I may be speaking a lot of jargon, but what these drugs are basically drugs which inhibit multiple different pathways, including pathways that affect how blood vessels grow. Okay, there is some link that is not entirely elucidated, but I think the body of evidence is growing to suggest that by affecting, vessel growth and the growth of the cells in and around the tumor, so the stroma of the tumor is also vitally important to allow our own immune cells to be able to enter the tumor, to be able to kill the tumor, which is what we are facilitating by using immune checkpoint inhibitors. So, Gary, immune checkpoint inhibitors are actually drugs which are given to allow our immune cells to say, hey, I should be killing this sarcoma cell. Okay, so in other words, the immune cells have gotten to the sarcoma cell, but they've somehow been masked, to say, I'm friendly, I'm actually, a good part of your body, you shouldn't be killing me. So the cancer cells or the sarcoma cells have actually been able to mask themselves away from your immune cells, when immune cells should actually be doing their job, and clearing away or attacking these sarcoma cells. So immune checkpoint inhibitors actually do that. But Tommy is absolutely right by saying that immune checkpoint inhibition alone doesn't seem to give very, very good responses. So the way to increase this response is potentially, Tommy, to combine this with some of the other drugs, including multiple tyrosine kinase inhibitors, anti-angiogenic inhibitors, sometimes with chemotherapy as well. But in general, I think the results from those haven't been as effective as the former. So I hope that answers the question. Yeah.
Wow, that's a lot of information. And what I take away from that, to be very honest with you, is I understand what you're talking about, but I would say that the biggest takeaway is, if you have a question, please go and see the sarcoma specialist, Dr. Valerie, or anybody else, to actually get specific medical advice for yourself, because I'm sure everybody's going to be a little bit different. You might have tried different therapies or different combinations that may or may not have been so successful. And, this is really why we're hosting these sessions, is for you to understand that, unfortunately, sometimes it can be not so straightforward. And we've got experts like Dr. Valerie, who's, been there in the real world and been able to, I guess, work together with other experts to find maybe new strategies or different combinations of treatment. And I think that's really, really powerful. And of course, it also gives hope as well. And so I'm glad to hear that there are different. So thank you so much for your question. But also just to highlight that, how important it is for the screenings that we provide for, early detection, if we can, for seeking, treatment, or not even seeking treatment, but just getting a lump checked out. I did have a question, Dr. Valerie, because at the very start, you sort of showed a slide and I had, signs and symptoms. And, you talked about swelling, you talked about lumps, you talked about swelling. Is there anything specific that we can sort of look at to really know, like, whether to suspect a sarcoma? I mean, obviously we don't want everybody on our session here today to have bump and then go, oh my goodness, and kind of freak out, right? So is there anything in particular that we just that one thing that we just watch out for, or two things that we watch out for to go, hey, maybe I shouldn't wait another 2 weeks to see whether it's something, I should probably just get ask some questions?
Yeah, thanks, Gary. So, absolutely right. We shouldn't be causing, widespread pandemonium for any lump. To be honest, most lumps are actually benign, so most people are absolutely right to think that it's benign. Okay. Maybe some of the more sort of suspicious red flags would be if a lump, is past a certain size. Okay. So, most benign lumps won't exceed, approximately 5 centimeters across. So if a lump anywhere you've got in your body is already that size or bigger, that already rings a few alarm bells to say, maybe it could be a slow growing sarcoma, even if it's hidden there for some time. Okay. Or if it's one of those more aggressive types of sarcomas, then you notice something like a lump that's growing bigger over a more rapid period of time. So maybe over weeks as opposed to, oh, it's been sitting there for years. So I think those are the two main distinctions I would make, I'd say. But at the same time, I completely appreciate the fact that it can be very vague in terms of presentation, which is why, a lot of the time, some of the patients who are diagnosed come to us and like what we chatted about earlier, it's they've undergone what we call a whoops surgery. It's like they've, removed something and then realize later on, whoops, it's a sarcoma, without sort of suspecting prior to having it removed that it could have been a sarcoma. So yeah, I'd say maybe those two things. So the size being more than 5 centimeters across, and if it's something that's growing fairly rapidly over weeks as opposed to years.
Mm. So does that mean that if it's growing rapidly, it's more aggressive and it's more dangerous?
Yes and no. So it really depends on the subtype that it is. But certainly, if it's, I mean, it can be a bit of a double edged sword. So some of the ones that grow more rapidly could also be more responsive to treatments. So it doesn't necessarily mean it's a bad thing. It just means you should come and see your doctor. This is more likely going to be a cancer than something benign. But at the same time, it doesn't mean we can't treat it. Maybe you've got a good chance that we can treat it because, a lot of the agents that we use actually target rapidly dividing cells. So don't be scared. Come see somebody and we'll get it checked out for you.
Okay, fantastic. Are there any more questions out there? I actually do have one, but I don't want to hog the show,
No. Yeah, I actually wanted to jump in and say something, Gary, if I may, because I think you
please.
brought up a very good point earlier on to say, it's rare and it's very challenging. It's difficult for patients, to go through this because, don't really know what to expect. I think it's tough enough, having a cancer, having a breast cancer or a lung cancer or a colon cancer that's more common. And there's actually, much more information out there, for someone with a more common type of cancer. But for someone with a sarcoma, first of all, they're like, what on earth is a sarcoma? I've never heard of it in my life, there's so little information, and some of the information that is available is, either wrong or not rightly represented and can be very scary. So there's a lot more unknown, and I think just having that additional layer of complexity makes it a lot more stressful for people with a cancer that is rare compared to something that's common. So just to say that I think, the healthcare professionals who deal with this completely recognize this as well, and it's just something that whoever's got this also should recognize. So seek help, not just medical but psychological as well, mental, emotional. All this is vitally important, in the way in which we deal with the condition. And you're more than your cancer, and I think there's many things that can be done and many good people who can support those of us who do have sarcoma.
Actually, you've mentioned a couple of times sort of there's another layer of complexity with sarcomas, and because they're rare and there's maybe less understanding than some of the more common cancers, I'm just curious, like, how does a sarcoma actually differ between, other more common types of cancers? What is the level of complexity, or what changes are different that, make a sarcoma that's complex and difficult?
Yeah. Okay. So that's a very difficult question to answer, Gary, because there's so many layers. But just to say simply, when something is rare compared to when something is common, just having that lack of data already makes everything so difficult to do, right? So there's lack of information, there's lack of awareness, people don't know how to diagnose it. Even if they've diagnosed it, they don't know what to do about it, just because it's rare, right? So that's already in and of itself. But biologically, they're very different as well. So most cancers tend to arise from what we call the epithelial cells, or like the outer, types of cells which cover most of our organs, whereas sarcomas tend to be mesenchymal. They come from connective tissue, so their biological behavior is quite different as well. So they tend not to be very sensitive to most chemotherapies, which also makes it challenging. So that's why it's very important that we kind of know how to manage this. And we often use, therefore, what we say, multi-modality type treatments to treat sarcomas. So it's really not just, simple use of chemotherapy alone. Often it's a combination of local therapies, whether it's surgery, radiation, sometimes ablative approaches, in combination with chemotherapies, where we choose how to use it wisely, because we certainly also don't want a situation where we've got someone suffering the effects of very toxic treatments without good benefits. So that's why it's very, very important that we know how to manage this optimally. I hope that answers the question simply, because it's quite a complex question to answer.
No, it is, and yeah, and I'm just curious, and of course, yeah, like you said, if it's arising from a different part of the body, it's different cells that are affected, then of course the treatments would possibly also need to be different as well, right? And the mechanisms that play internally in the body.
Absolutely.
Yeah, wonderful. All right, we've talked about quite a lot of things, Dr. Valerie, this evening, and before you take your leave this evening, is there anything else that we may not have covered that you would like to share?
I think we've been very comprehensive, and it's just one of those things that unfortunately is very rare and very difficult to manage. But just to say, if anyone out there has a sarcoma or knows somebody who has a sarcoma, don't despair. There are good people who know how to deal with these things, and very, very happy to help. And do reach out, and just to say we're nice and friendly, okay? And also just to remind everybody, regardless of whatever condition you've got, just don't be afraid, to seek help, to seek medical advice. And remember that your body is your own, okay? So if you're not comfortable with anything, you have the right to say, hang on, I need to ask you more questions, or, if you want to do this, why are you doing it? So feel free to challenge your doctor as well. And I think that's always good for any patient to do. And you should be comfortable, speaking with the doctor who's looking after you as well. Yeah.
Yes. Okay, wonderful. Well, thank you very, very much for your time. If there are any final questions, now's your chance. If not, I would love to thank you, Dr. Valerie, for your sharing, for answering all these questions, and of course, spending your Saturday evening with us here on 365 Live. It's time for Dr. Valerie to take her leave, so please give us some love in the comments. And thank you once again for sharing your insights this evening.
Thank you, Gary, and thank you everybody for coming. Happy to be of service. Have a good Saturday evening, everybody.
Thank you for being here. Do like, share, follow us on our social media pages for the latest updates on our events. I really appreciate you joining tonight. Thank you for giving Dr. Young some love. And once again, have a wonderful evening. I'll see you guys in the next session. Till then, take care, stay healthy, and have a wonderful evening.